So good afternoon for most of you and good morning on the West Coast for those of you who are out there. Welcome to C4 September Power Hour. Before we get our program started, please feel free to use the chat box to introduce yourself and let people know where you're from and who you are. So we're going to get started in a second. Again, welcome. I'm Larry Robertson, one of the members of C4's organizational development team, and I'll be moderating today's discussion. So we're going to go to slide 2. It's a fairly large group today, so we had to mute all attendees coming into the room. However, we want to make sure it's as interactive and responsive as possible. So feel free, if you have questions that you want to pose to the presenters, post those in the chat box, and we'll get to as many as we can. Also, if you have any issues on the technical side, put that in the chat box as well, and our tech support will reach out to you. Today, we're excited to present a timely topic, strategies for rapid organizational learning during times of uncertainty. And I think we've all been hearing that term on commercials lately, during these uncertain times. To say that we live in times that require constant resetting and adaptation would really be an understatement. While we really have no idea what the next normal is going to be, we are all pretty much aware of what today's reality is. And so the question on the table today, and at the core of the conversation we're having today, is how do organizations adapt to that reality? And I want to offer a quick story to provide some context before I pass the baton along. Some of you have probably read the book, I've heard of the book, Good to Great, and it's essentially based on a series of studies, retrospective studies that Jim Collins and his team at Stanford did. One of the stories that he talks about in the book is actually based on a conversation he had with Admiral James Stockdale. And if any of you know who Admiral James Stockdale was, he was the highest ranking naval officer who ended up as a POW in the Hanoi Hilton during the Vietnam War. He also, just as an aside, was a vice presidential candidate in 1992 along with H. Ross Perot, when Perot ran for president. That's just trivial, inconsequential information. They had, at some point in time, Stockdale may have been a visiting professor or something at Stanford, and he happened to meet Jim Collins, and on a walk across campus, Collins, in his infinite curiosity, asked Stockdale about who were the people who did not survive the POW experience in Vietnam. And without hesitation, Stockdale said, the optimists. And it sounds counterintuitive, but he went on to explain that it was the people who had this belief that they were going to be out by Christmas. Christmas came and Christmas went. They weren't out. So they kicked the can down the road. Easter came and Easter went, and they weren't out. Thanksgiving, then Christmas again. And essentially what Stockdale was conveying was the story of who was able to survive were the people who were the adapters, essentially. And so what they had done was found new structure, new processes, and communication modes to adapt to the reality that they existed in. And that's how they got through it. So we're going to talk a lot today about organizational learning or rapid organizational learning, but this is really a good example of that in extremely dire circumstances. And I'm going to read what Jim Collins put in the book as, and he referred to as the Stockdale paradox, and some of you may have heard it before. You must never confuse faith that you will prevail in the end, which you can never afford to lose, with the discipline to confront the most brutal facts of your current reality, whatever they may be. And I think while that was stated based on a context that was really dire, it does put some context on where we exist today. How do organizations make the pivot to do the resetting, to do the adaptation? And so what we're going to hear from our two presenters today is exactly how that's done. And we're going to talk about organizational learning. So without further ado, I'm going to present to you the two presenters. So there's my colleague Susan Foster, who is has a master's in public health as well as a master's in social work on the top. So Susan has more than 25 years of research and program evaluation experience. She also has an independent consulting practice that focuses on complex community-based system change initiatives, quite apropos to what we're talking about today. She uses multi-method and multidisciplinary and participatory approaches to serve the learning needs of community members and organizations alike. And what's helpful about today's conversation is that Susan has a particular passion for helping small nonprofit organizations and local collaboratives create low-burden evaluation, which is a large part of the theme of today, and learning plans that assess program effectiveness in real time. And so much like Stockdale and his crew, they had to actually make those adaptations in the now. So her background also includes evaluation of health-related system change initiatives in tribal, urban, and rural communities across the country. So pretty much a range of environments. Then there's our other colleague, Justine Hansen, who has a PhD and is a sociocultural anthropologist with more than 20 years of experience conducting qualitative and ethnographic needs assessments, evaluations, and research projects. Her work has been dedicated to informing and improving programs and services for vulnerable populations, and also ensuring that policies, programs, and products are deeply informed by the voices, needs, and values of those they are intended to serve. So how do you actually make evaluation, as an example, something that is put to use? And that's a big question in the evaluation field. Her work is specifically focused on understanding the needs of diverse groups, stakeholders, and populations such as individuals, families, and LGBT, youth experiencing homelessness, peer support workers, women in recovery from opioid use disorder, housing and human service providers, refugee resettlement service providers, and many other groups and service providers in both the United States, Central America, and South America. And so with no further ado, I'm going to turn it over to Susan and Justine.
Thank you, Larry, and good afternoon, good morning, everyone. It is such a pleasure to be here and see so many of you joining us. Thank you for being here. We're really excited. This is our second C4's organizational development team. We've just started this series. It's a monthly Power Hour series where we share insights and strategies and tools, things that we're thinking about. So today we're really excited to be talking about organizational learning and how it's so important, even more now than ever. I am a senior associate here at C4 Innovations. My pronouns are she, hers, and hers. And I will turn it over to my colleague, Susan.
Hi, I'm Susan, and I'm thrilled to be here today to talk about one of my favorite topics. So I use she, her pronouns, and I want to tell you a little bit about the goals for the day. Oh, I should probably say what my affiliation is. I work part-time at C4, and the rest of the time I do evaluation and learning work, as well as strategy and a lot of group facilitation these days. So let me tell you quickly about the goals for this afternoon. We're going to talk to you a little bit about what rapid cycle learning is, the way sort of we define it, how that supports decision-making and adaptation, and learn about a few specific low-cost, user-friendly ways to assess effectiveness. The way it's going to go is Justine will sort of set the stage for us in a slide, and then I'll have a couple of slides describing rapid cycle learning, and I'll give you an example from my work up in Maine. And then I'll turn it back to Justine, who will describe the approach in a little more detail, and then we'll open it up to questions, some of which come from you on your registrations, and some which we'll ask for over the course of our time together. So with that said, Justine, why don't you start us off?
Great, thank you, Susan. And just a note, if you haven't already, please introduce yourself in the chat box. It's wonderful to see so many folks from all across the country joining us today in so many different roles. And at any time, if there's any questions for us, don't feel like you need to wait till the end, or when we stop talking, please, any questions you have that you'd like to have addressed, a situation that you're dealing with, you'd like some consultation, please just go ahead and pop that in the chat box, and what we'll do is we have a holding area. We'll pull those questions, and then once we finish our brief presentation, we will address those questions. So here we are, 6 months into a global pandemic that very few of us ever could have anticipated. We here at C4 work with organizations and health and human services across the gamut, and we have been hearing about all the challenges and changes that everyone has been experiencing, and it's changing daily, especially with other events like wildfires and hurricanes. Our country is definitely, we are in tough times, and the health and human service organizations are really at the front lines of trying to help people through these challenges. You all had to turn on a dime to move your programming online rapidly, and I'm sure that involved, supporting staff to learn new technology, figuring out how to engage with the folks you serve without face-to-face contact. And in health and human services, so much of our work is about that face-to-face individual rapport and relationships, and now doing everything over Zoom and telehealth. And then you had to spend money on new technological platforms and figure out how to make them work. We know that many of you had to really pivot to create new services, to meet new needs, or even to blend services. So, and especially as some states have been opening up, some things are face-to-face, some things are online, and it's just a whole new mix. We also know that you're seeing, you're changing in how you're engaging with the people you're serving, but also seeing more engagement in some ways. We've been hearing a lot about folks that are getting participants in online meetings from across the world. There's a whole new global audience now that can access our services, and that's pretty exciting. But then we're also losing contact with other folks and seeing less engagement in some areas. And it's been very interesting to hear how some folks who work with youth and young adults are seeing huge increase in engagement, something really unprecedented, while folks that may work with older adults are really losing contact with people. So many challenges. And then combined with this are all the new stressors on staff who are trying to navigate work and home responsibility, working in the closet, or having pets and children and spouses and other family members around. It's so tough. And then those who are still working face-to-face, they're really balancing personal risk of exposure. And then there's also, we're not even talking about revenue loss and budget cuts and staffing cuts and just the financial uncertainty that everyone is facing. So we just want to acknowledge that this is the reality that everyone is coping with. And then we'd like to hear from you about, so we have a little poll that we'll pull up right now. And basically, we're just asking, what is the biggest challenge that your organization is facing right now? So just one challenge. Please just pick one. And if you there's a little scroll bar on the right, so it goes all the way down to no vote. And if your challenge is not here, please type it in the chat box. So we'll just take a moment for everyone to tell us their biggest challenge. And again, if your challenge is not listed here, please type it in the chat box, and we'll just give you a moment for that. And again, if anyone's having any technical challenges, feel free to just type it into that chat box, and our very capable tech team will assist you. Okay, so just give you another minute, but it really is looking at like new stressors on staff is the biggest challenge. About 40% of you have picked that, far and above the other challenges. Oops, going up to 42%. So I'm just going to read from the chat box if there's any folks that are just with us on the phone. Erna typed in new stressors on staff, training new staff remotely. That's a huge challenge. Patricia's saying our team of volunteers are mostly over the age of 65. We work directly with vulnerable adults in nursing homes. Loss of volunteers due to COVID, that's huge. Beverly is saying another challenge is finance to implement the changes, being able to fund the changes. And we'll just give it another minute or two as I see a few other folks are typing in the challenges. And back to the poll, it looks like, so new stressors on staff is number one, but let's see if I can parse. It looks like right behind that are more engagement. So folks are seeing more engagement in services. That's interesting because that means you're dealing with more folks needing help or needing services. Oh, sorry. So new stressors and staff. Then we go to changing the ways you engage with people you serve, and then it's more engagement. Those are the, and revenue loss. New stressors and staff, remote work, workplace injuries. Oh, need for ergonomically correct equipment. That is huge. All right. Well, thank you all so much for taking a minute to share your challenges with us. So basically, we are here to say that no matter the challenges you're facing, they pose new opportunities for organizational learning and creativity. We really believe that more than ever is the time to ask questions, listen deeply, learn what's working and what's not. And I think often we think of evaluation as this big thing that takes a lot of time and expertise and has to happen, has to be designed and needs funding and happens after the project is over or the service has been delivered. But what we're really talking about today are some strategies and tools and processes to really build assessment. It is evaluation. We can talk about terminology, but really to, I guess, organizational learning, back to our main topic, to really build organizational learning into everything we do, and just some strategies to really help us gather insight rapidly to make informed decisions in these times of rapid change and uncertainty. And Susan is going to walk us through the rapid cycle learning model.
I guess I have to advance the slide. Oh, there we go. So I'm really moved and struck by a lot of the challenges that you're describing, people having to delay funerals, loss of volunteers. I'm going to be talking a little bit about the volunteer experience in the example that I give, but it's really striking, and my heart goes out to all of you for all that you're dealing with and working through. So as Justine was saying, this is obviously a time of rapid change in which you've had to design. You're doing design work all the time, but you're having to do it on the fly. And you're having to try new things without the time to make them perfect, which actually, I'm going to tell you, is okay. You're in the middle of an experiment, as we all are, and rapid cycle learning, the reason we want to talk about this today partly is because it doesn't take a lot of investment, and it's really a nice tool that you can use to get the feedback you need to make real-time decisions. It is not formal evaluation. It uses pretty quick user-friendly methods. Formal evaluation I think of as more long-term. This is more about taking a pulse, what's happening right now, and how can we use this information to move forward. So as an organization, being open-minded and willing to fail makes you open to learning and innovation, and just keep that in mind as we talk about this. So here's how it works. I at least, and I'm sure you do as well, believe that the best ideas come from our stakeholders. And by stakeholders, I mean the people that you serve, I mean your staff, I mean your volunteers, and your partners in the community. So your stakeholders come up with a great idea. This is how we think things should go. Then you try it out, which is we're moving around the slide. You try it out. Usually the best way to try it out is don't expend all of your resources doing this at first. Just pilot it over a short time or with a small group of people. Then you assess what's working and not working by asking people how they experienced it, how satisfied they were, what they want us to do more of, less of. What about the process and the implementation of the pilot or the experiment worked well or not so well? So if it works, you take what works and you adapt based on the feedback you get, and then you deepen your investment. But I also want to talk about letting go, because I think when organizations are so committed to their mission, sometimes we think we have to keep going with everything that we're working on, whether it's working or not. Or sometimes we don't know if it's working, but we're so panicked about being responsive that we just want to keep going. What I have learned in my work is that it's okay to let go of something that is not working. It helps you avoid spending money and time on strategies that are unlikely to produce the results you need. And the final step is that this isn't over once you make a decision about where you're going to go next. It's really a cyclical process, and that's about how your organization approaches learning. This takes people skills, it takes teamwork, it takes organizational commitment, and it really requires a new way of thinking. And it takes participation from all staff. This isn't just the program leader's job. So I'm going to give you an example. This is from a program up in northern Maine called Piscataquis, Healthy Food for All. And just to give you the context, this is a county that has about 4 people per square mile. It's very poorly resourced. There aren't that many people there to, people are not falling all over each other, trying to do the same work. There are huge gaps. There's a lot of poverty. So I'm just going to go show you how it worked in practice. So the problem in one of the smallest towns in this county was that children were going hungry in the summer. There was a mom in the town who was hearing kids were coming to her house saying they didn't have any lunch, and so she told the town manager, and he heard about a grant program, which I was evaluating, where they were, their job was to increase access to healthy food for all, obviously. So the grant program talked to families and town leaders about what might work there in creating a summer lunch program. The principles the grant people followed was start small in order to grow, low risk, low investment. So they initiate this summer lunch program, and if you can imagine, the grant program is not that well funded, so there is a leader, a coordinator, and there is a VISTA volunteer, and together they are schlepping the food, they're doing everything. 2 kids show up. By the end of the summer, they'd served 100 meals, which was pretty good. It was slowly growing. And what Erin, the leader, told me was that assessment basically works out the kinks, demonstrates what works. And what they used to figure it all out was a form of debriefing. They met with local leaders, partners, participants, and volunteers to get their feedback, and they did it right away. That's the key. You don't wait. Well, everything's fresh in people's minds. So the types of questions: what did we set out to do? What happened? Why? What do we do next time? And they found that one of the big lessons, for those of you who work with volunteers, was in how to recruit and retain volunteers. And they became much more organized the following year. What they found out was that volunteers need to know exactly what they're supposed to do. It has to be a short window of time, and everything needs to be delimited and clear. So they improved their volunteer recruitment in the next year. And in terms of letting go, what the grant program lead really needed to understand was that in order for this to be sustained, she needed to let go. And community members, it was important to cede control and leadership to community members. Fortunately, the town manager, who was also the police chief and the fire chief, became very excited and basically adopted the program. They, realizing this was a really feasible program that had demonstrable benefits, a civic organization donated $2,000, and they have now documented this program. The grant person, the final step was to just say how it works very quickly, and they've expanded this program to 5 more towns. So that's just an example of how this can work in practices. And in the resource list that you'll see later, there's a case study that describes the process in detail. So with that, Justine, I'll send it back to you.
Thanks, Susan. Great. So how do you do this? How do you start? And one way I think to start is to really be inspired by the ethos of design thinking, which is, and Susan alluded to this in the beginning about it's okay to fail about it. And design thinking is really the way I interpret my kind of take on design thinking for this this presentation is that it's really about building your way forward and failing fast and failing forward. So it's about trying things and just going forward, trying something, putting out in the world, getting feedback, changing it, refining it, putting it back out into the world, getting feedback, just building that feedback loop into the process. And I think so often we want things to be perfect. We want to create the perfect service, the perfect product, and spend all this time developing it and then put it out and find out maybe there's some fatal flaws. But design thinking is really about, they call it rapid prototyping. So creating something quickly, putting out into the world, getting that feedback, refining. It's really this iterative process where getting feedback is critical, and just trying things. So just to kind of break this down a bit, the way I would break this down is really begin with curiosity. And by that I mean not fear. Be willing to try new things, be open to learning, be open to not knowing what will happen. And I think it's, so for example, say you have an online peer support group that engagement is low. And instead of starting from the approach of like, we must be doing something wrong, what are we doing wrong? So often we go to that place, that negative place of how have we screwed up? But try to start with from a place of curiosity of what can we learn here? What are the ingredients for good engagement? What creates good engagement? What do folks really need? So just start with that curiosity rather than the more negative stuff that we sometimes automatically go to. And then you really want to narrow your focus. You want to pick an aspect or an area. You want to figure out what is that thing that you really want to know about. I am the kind of person that I want to know about everything. I want to ask every single question, but that is not what we're talking about today, and that's not really what's helpful. So really, really narrow. Really try to keep it a very realistic scope. In design thinking, they talk about picking the problem you can actually work on, so picking something that you actually will be able to tweak and change. And in design thinking, they talk about gravity problems, and these are the problems that we can't change. So the example they always use are the fact that poets are low paid in our society, but the gravity problem is the fact that we're in a pandemic. We are living with physical distancing, things that we just can't change. So really, as part of that narrowing your focus is picking that realistic scope. And, just to add on to that, something I've been thinking about, and I think this ties into what Larry was saying, is this idea, and this came from the design thinking folks, about generative acceptance. It's really accepting where we are and figuring out within these constraints, how can we be creative? How can we build meaningful lives and organizations and still do the best we can in terms of the folks we serve? So next, number 3, ask questions, listen, and learn. This is otherwise known as the research phase. So you want to, once you've narrowed your focus, you want to figure out what are the narrow questions, really concrete, specific questions. And then you want to figure out how to talk to people or to get feedback. And we'll talk about that later, but it could be as simple as building that in. So if you're doing, for example, using the group of the online peer group, the 3 questions I love are, what's working, what's not working, and what would you change? You can build that into your team meetings. You could build that into your online group. You can do short surveys. You can get a free account on SurveyMonkey and ask a very short survey, like up to 5 questions. You can do interviews. You can even do focus groups. But we can talk more about that later. I won't go too much into that. But I think it's really important to not lose sight of the fact that the people you serve are your most important source of information. And you also want to make sure you're getting a range of viewpoints, that you're asking different people, and that you're really listening. So next, you want to review what you've learned. You want to take what you've learned, pull a few people together in your team. It shouldn't just be 1 or 2 people. It should be several people who are looking at what you've learned and see what sticks out, see what's actionable, see, what can you actually do. And again, this is also about kind of being ruthlessly pragmatic. What can you actually do? And then you make decisions. You decide, do you want to tweak something, let go of it entirely, make new investments, what make that decision, and then repeat. And the reason we say that is this is about exercising the muscles of just building learning into everything you do. And it could be that as part of your team meetings, you're looking at satisfaction survey. That's always a standing agenda item, and everyone's looking at them together and commenting on them. But just So repeat meaning just to don't let this be a one-off thing. So now we're going to transition to some of your questions. We've seen a few coming in the chat box, but feel free to put your questions in, and we're actually going to take away the slides, so it'll just be us on screen, and then we'll bring the slides back at the closing, and we'll tell you a little bit. I actually saw a question coming in the chat box about fundraising, and our next event we'll talk a little bit about that before we close. So I will turn it over to Larry.
So I actually, I'm going to maybe make a statement that I heard you all mention in a few different ways, that, and Susan in particular, that by letting go of things, you're not abandoning your core mission, that you're basically changing how you achieve the mission. And I think that's a part of the adaptability that you guys have been conveying today. That's a really important concept, that your mission isn't necessarily the widgets of what you do. It's really the outcomes of what you're trying to achieve. And so I thought that was a really important point. So we're going to go to some of the questions, and some of the questions we got before the event. So thanks to those folks who sent those in advance. And I'll start with the first one up on the list. What are some ways to gather quality input rapidly? And so Susan, I'll toss it to you first.
Okay. I think Justine alluded to a couple of these, but I think a great way is to, if you're on a Zoom call or a video call, polls are a great way to get the pulse of a group. Feedback surveys, people are so sick of surveys. However, if you put the link to the feedback survey right in the chat, and give people time to fill it out before they leave you, you'll get better information. I would also say quick debriefs are a great way to get information. Collecting stories, having your staff bring back stories from the field, I think is really, really important to, and one thing that was suggested to me yesterday was to get video of people's voices, or audio of people's voices telling their stories, or record video, so that it's not just for getting quick feedback. It may be that what you're implementing right now is going to be really important going forward, and this is information that you can use for communications. It's information that you can use to tell your story to people who may not understand, like your board, may not understand why you've made this pivot at this time and what that means. Justine, do you want to add anything?
Yes, those are all great ideas. I think, it can be as simple as, if you're in a Zoom meeting, there's these reaction emojis. You can ask people thumbs up or thumbs down, in the moment type of feedback. That's like a very simple way. Again, with surveys, I think you want to keep it really short, maybe a maximum of 5 questions. You can get a free SurveyMonkey account. I am a big fan of qualitative data, meaning interviews and focus groups and really talking to people. That can take more time, but you can design short. You could do short phone surveys, or even pull together people in a Zoom meeting. A small focus group that can be done. It can be done quickly. You do also, I think one caveat, of course, when you're asking folks is you want to always tell them what the information will be used for and give them the option to maintain confidentiality and let them know, anything they share, where it's going and who has access to it. And generally it's best to just keep things confidential and say, a client said this, or a stakeholder, a partner. But I think what's really critical is also to really talk to different people. Don't talk to the same suspects, because everyone has different viewpoints, and it's really critical to get that. But I think in a lot of ways you kind of have to tailor the methods to what it is that you're trying to learn. So if anyone has examples, if there's any folks out there in our audience have an example of something they'd like to learn about, or they'd like to put through this process, if you want to type that in the chat box, we can brainstorm a bit on some methods for you.
I think what's great about the response is Go ahead.
Go ahead. I was just going to say, or if you've tried something methods-wise that you think works really well, let us know. We're in the learning mode too.
Yeah. So what was important about the points you all just provided was the fact that you didn't talk about anything that was laborious, elaborate, and really required a great measure of science to get to it. And I think that's a part of the story of today, that don't sit on, looking for answers because you don't have the definitive perfect design. It's better to know what you can get to know than not know at all. So I think that was a good lesson learned from what you all just mentioned. So you ready for another question?
Sure.
All right. So what are some strategies for evaluating very new processes with limited data available? How soon is too soon?
Well, I'll start on that one. I don't think it's ever too soon to collect information and to get feedback. One of the tricks that I think works well is related to what Justine was saying before. You don't want to close off people's ideas too early. So if you do a little survey with somebody, leave some room for open-ended questions so that they can share their new ideas with you. And give you suggestions that you might not have thought of yourself. So that's certainly something to think about. But again, it's never too soon, because even if you end up maintaining this piece of work or this program or strategy for a while, you're collecting baseline information. And I just want to give an example of an organization I work with that when COVID hit, this organization contacted 600 people who they serve in their community to find out what they needed, what was going on, what their lives were like in order to respond. And they never really wrote down what anybody said. And I would say that was an opportunity for collecting baseline information on the needs of their community. This was the immigrant and refugee community that, would have been very interesting to have at that time. So I'm a big fan of collecting usable information early.
I agree, Susan, and I think I completely agree with your response that it's never too soon. And it's really, I think, also about building kind of evaluative questions into the process. If you are creating a new process, building in those questions along the way and making sure that the folks who are trying it, again, I go back to those 3 basic questions, which actually can yield some really important data. What's working, what's not working, and what do you, and you meaning you, not like we, what would you change about this? So I think building those questions into your processes, at least for any new processes, is important. And then maybe phasing them, you ask them a lot, and maybe you just ask them with less frequency once something becomes more institutionalized. You don't stop asking, but you don't ask at every turn, perhaps.
So is it the experience that you all have that as you go along, you can refine the nature of the questions more precisely, because as you learn along the way, that what's reliable in the way of a question to ask, and what's not going to net you the kind of information you're looking for.
That is such a good point, Larry, because sometimes you don't know what questions to ask. Sometimes you're really taking a stab in the dark, and you're making your best guess of the questions. And that's why talking to people, because you'll know very quickly what questions resonate and what questions just don't resonate, or they're total dud, is something that maybe you thought was going to be an issue, but really isn't at all. But then something that maybe you didn't think was a big deal. So you really also, so that's the piece of really deeply listening, seeing where people, and that's harder when we're not doing things face-to-face. It's harder to do over the phone. It's harder to do over to Zoom, to really see how something lands on someone and resonates. I know certainly when I've been doing focus groups, it becomes very clear right away when there's a question that maybe I didn't think had a lot of depth to, but it hits a nerve, and then from that there's a number of follow-up questions. So I think that's why it is so important to not be afraid to ask questions, because that's how you find out which questions are important and what things are resonating. And we don't always know how things land with other people. We are all approaching the world from our viewpoint, which is very discrete and limited.
Yeah. And I think it goes back to your earlier point about being infinitely curious, because it's more important, as I often say, to ask the right questions than to have all the answers. Because you can find the answers, but you don't if you don't have the questions. So there's a set of questions, and I'm going to kind of maybe synopsize them and throw them at you, around how do you actually get buy-in to this notion of this kind of rapid cycle learning and evaluation, both buy-in from the group, the organization as a whole, but also more importantly, things don't go too far if it's not being spearheaded at the upper echelon of an organization. And so how do you get it, from the troops, and how do you get it from the helm of the organization?
So I guess I have a couple things to say about that. One is that given what we were saying before about the whole purpose of rapid cycle learning, it's to save resources and direct resources where they're most needed and where they're most effective. So I would say a great argument to leadership is let's engage in some rapid cycle learning that all of us participate in so that we know what's working and we know where to direct our resources. The other piece is you may miss opportunities that you didn't know existed. It was the example that Justine or Larry gave earlier of people from all over the world attending a session or a book opening or whatever by Zoom. It was never expected, but very exciting. And a lot of people I know who are counselors and therapists are finding that a lot of the people they work with prefer to be seen remotely or in a virtual setting. So that's always a surprising. And always keep in mind that your staff, your volunteers, and the people you serve know best. And a great organizational leader will recognize that and embrace it and honor it.
Well put, Susan. I don't think I have anything to add.
Yeah. I think as people talk about inclusion in organizations, we, because of all the social justice issues going about today, that kind of tends to make the major frame of the discussion. But inclusion also means that kind of participatory approach that Susan just laid out, where you're really looking for the information where it lies, and it's both from different data sources and different stakeholders, and so it's really important to go to those sources to get that really global view of what's taking place in an organization. So going to ask this question that came in the chat a little bit ago from Susan Bennett, and I'll read it. This is in small print, and I don't want to screw it up. As of now, revenue is down 35%, and I assume in her organization. But next is we have to move 6 fundraisers to the spring, so they're expecting revenue to drop even more. Trying to get sponsors on board in the fall, trying to do an online auction in November, looking at promoting monthly giving program. I want to learn how to access results. How do we set goals in this environment? And I presume financial goals in terms of fundraising. And then we'll give a shameless plug to next month's event.
Yeah. Justine, do you want to take a crack at that one?
I will just I'll take a stab at this. It sounds like you're saying, how do we set fundraising goals in this environment with so much uncertainty? And it sounds like you're asking, how do we use rapid cycle learning to kind of get some insight into the type of goals we could set? So that's how I'm interpreting your question. And I think my immediate reaction would be to maybe, see if you can reach out to some of your donors and find out kind of what, just ask them candidly, where are you able to sustain your giving or reduce it or increase it or what? I mean, maybe just kind of reach out to them and have some conversations to find out, to help give you some intel if something, and maybe it's say, providing, we might do an online auction, we might do monthly giving, and really also asking for their ideas. So I think the other piece that we haven't talked about is so much of this is about co-creation, about working together with our stakeholders, our donors, the people we serve, And so I would say to reach out to them and ask them for help, for insight, and to run some ideas by. That's my immediate reaction. What do you think, Susan?
No, I agree with that. I'm working with an organization right now that they came to me and they said they wanted to do a 10-year strategic plan right now. And what we agreed to after about 10 minutes was, we can't do a 10-year strategic plan right now. That's impossible. We need to do a 6-month plan. We need to do a year plan. And it was a turning point for the board, because the board was more of a, listen to the executive director kind of board, push information at them. And the board's role is really changing into a working board, particularly around fundraising issues, because it's so critical as they move to virtual venues. So the executive director is really leaning on the board a lot more.
I think the other critical thing, though, is that, what that pivot that Susan just mentioned with the board is what organizations are going to have to do these days, is make strategic decisions about what priorities are. And there may be decisions in terms of how do we shift how we go about fundraising, how do we shift the services that we provide. And so my shameless plug is, and I'm going to mention it again, is next month Power Hour is going to be put the fund back into fund development. One of the biggest challenges I think we've all been facing as consultants is dealing with organizations that have been strapped for cash these days. And this is going to be quite timely. So we're going to be doing it October 15th. Let's see, another question. What are some methods for engaging in learning and co-created change amidst stressful times?
Well, one thing that I've been involved in Lewiston, Auburn, in Maine, is this figure out how best to serve a rapidly changing community, and they really want to change the way they do their work. So they set up a co-design team, which was a really participatory process of people from the community who came together and collectively worked in 4 sessions to guide the foundation as to how they would proceed over time. Foundations have deep pockets, and this took a lot of work, but I do think you can do these kinds of processes much less expensively. Bringing together, small groups of people to guide you during a time like this, I think is a good idea. If you could add to that, Justine.
Right. I mean, it makes me think of one of the principles of design thinking is ask for help, create a team. Yeah. And I think that dovetails with what you said. But I think we are in a time where we have to create new partnerships. We have to combine forces. No one can kind of do this alone. No organization can really do this alone. So I think that's part of this co-creation is asking for help and reaching out and talking to people and asking questions, finding out what their challenges are, seeing how you can support each other, whether that's at a community level or a regional level. But I think the times demand of us.
Yeah. Yeah.
And the times also call for, we've been talking about some of the negative reactions of what's been taking place, but there are also opportunities that are out there that, if you think about medicine, they've been forced to use telehealth a lot more, which they really should have been doing long time ago. So how do we actually master technology today that we could have been using years ago? So that's one of the byproducts of today's situation. So one additional question is, can you address the issue of groupthink when getting evaluative information in a group? And I guess you'll have to interpret what the groupthink is.
Right. Well, I'll give it a shot. When I saw that question, I was very curious about it in the spirit of the day, and I was thinking about situations in which let's say the staff gets together and the loudest voice in the room says, ugh, that whole new thing that we tried stank. It's awful. I'm sure everybody hates it. Let's dump it. And that person has the loudest voice in the room, and so other people start piling on and saying, yeah, it was awful, this was awful, that was awful. I think it's really up to whoever's facilitating that meeting to, at that point, if one person is bogarting the whole conversation, do a round robin and get people's thoughts. Or there were a bunch of questions that came up in the registration about staff having a voice. One really nice technique is to have people take a minute. You ask them a question, take a minute, write it down on cards, and hand it in to the person who's the most objective in the room, which hopefully is the person facilitating the session, and have them just read what people had to say. So I would say round robin if everybody feels comfortable verbally, but also give people a chance to write and think, and speak anonymously.
Mm. Right, and Susan, when I saw that question too, I was thinking about, say, a focus group where someone airs a grievance, and then everyone's like, "Oh my gosh, yes, me too," and then it kind of devolves into like a event session. But sometimes I don't think that's such a bad thing, because the point of these modalities are for people to be heard. And often, I mean, I'm thinking about if I am doing a focus group with a group that often isn't heard or like I'm thinking, for example, I was doing a focus group with families experiencing homelessness living in a family shelter. Like, not many people ask them what they think or care about. They're not really asked their opinion that often. So I don't necessarily think it's a bad thing, but I think the key is extricating from that and then trying to get some deeper insight. So maybe that is like the round robin of like, so we hear that this is a problem, what are your thoughts on addressing it, or how is this, trying to get a more personalized answer so it's not just event session. But I do think that, if you're finding in, for example, the focus group that there's something that's touching a nerve and everyone, that's data, that's important. That's not, I don't think that's groupthink. I don't want to dismiss people's concerns and needs. I think it's also the skill of the facilitator and the questions you're asking, because you want to get questions that get to deeper insight, not just the event session. So those are my thoughts on that piece.
Oh, great. So we're kind of winding down to the bewitching hour. Just wanted to see if either or both of you actually have any essential points you want to leave folks with, any particular takeaways that you hope they walk away with from today's conversation.
I think for me, I'm really struck by the diversity in this, that we're in, working across age groups and contexts here, from everywhere from Alaska to Oregon and Washington to North Dakota to Georgia, and I'm just really struck by how I'm hoping that what we've had to say today is useful across all of those contexts. I think it is, but that's my hope that you'll take away from this.
Yes, thank you all so much for joining us and taking time out of your busy days. And I think what I would leave you with is just that cultivate curiosity, and that don't be afraid to ask questions. I think so often sometimes we're afraid to ask questions because we're afraid of what we find out, or we think of evaluation as possibly something that could be negative because we might find out that maybe we're not doing such a good job afterwards. But it's really about learning and growing and opening space for curiosity and asking questions, and I think that's part of co-creating. And if we are truly committed to person-centered, recovery-oriented services and care, that is about making sure that everyone's perspective, we're listening to everyone, and we're trying as much as possible to make sure people's voices are heard and fed into the work that we do. So thank you.
And I think, Justine, that's an important point, that health doesn't just lie in our recovery, it also lies in our leadership. And so this is a large part of the reason why we've been doing this, but along with the fact that the challenge in the challenge of today's times have really required us to really focus on this very intently. So again, thanks for attending today's Power Hour. We hope you found it useful. As you can see from the slide, if you have any more information you'd like to get from us or would like to contact us for a request for a consultation, you can contact Justine. She was the person who didn't step back when Susan and I were asked to contact. And so you contact Justine at the email address on the slide. You can also go to C4's website to learn more about our organizational development work. And be sure to join us next month for another Power Hour, putting the fun in fund development. That's going to be October 15th at 2 p.m. Eastern Time. Registration information is on the slide. And finally, we would really appreciate your feedback, so please be sure to complete the survey. It'll pop up on your screen as you exit. And with that, be safe until we see you again next month. Take care.
Thank you all.
Bye, everybody. Thanks so much.
Bye.